many of you may know, our very own Ohio County Hospital has the National Guard at its doorstep. On the phone, we have Miss Robinson, the PR for the hospital, and Second Lieutenant Matthew Chin of the National Guard. So can you both tell us what it is you actually do?
I sure can. I'll lead off. My name is CeCe Robinson, and actually I'm an alumni of Ohio County Middle School. And I'm very proud of the fact that I got to attend that same building that you go to school in every day. My job with Ohio County Healthcare is Director of Community Relations, which a portion of that responsibility is our public relations. And I'll let Lieutenant Chin give his title and job description.
I am Second Lieutenant Matthew Chin. I'm with the 2113th Transportation Company out of Paducah, Kentucky. Normally I'm a platoon leader for a maintenance platoon, but while working here at the hospital, I'm the liaison between the hospital administrators and my 9 personnel I have with me on route.
Can you both tell us a little bit about the situation going on at the hospital?
I sure can. So we are going on month 19 of the COVID pandemic. And we, since around December of 2019, January 2020, we have been implementing testing, treatment, and vaccination options to help stop the spread of COVID. This last month, we have seen a significant increase in volumes as our community, which has a pretty low vaccination rate. Our community overall, only 38% of our community has been vaccinated. And the current variant of the COVID pandemic, the Delta variant, tends to make people much more ill if you contract it, especially if you're unvaccinated and you contract it. So that has made for a much higher volumes in our testing, much higher volumes in our physician offices, and also a much higher rate of people who have to be hospitalized. They come through our ER and they're just sick enough from the Delta variant that they require hospitalization. And in many cases over the last month, they've had ventilators. We are seeing a trend that up to 85 to 90% of the people who are hospitalized from COVID are unvaccinated individuals. So our big message we're going to push out every time we talk to our public is take that opportunity and get vaccinated. So Lieutenant Chin?
Since last Monday, when my group arrived here, we've been helping out the hospital in more administrative roles, maintenance roles, and more assistant positions. We've been working in the ER front desk, the nurse station, maintenance, the supply, materials handling, and also administrative roles with care clinic.
So what has changed in your work schedule? I mean, there must be a huge difference from, pre-COVID and post-COVID.
Well, I'll let Lieutenant Chin talk about that because he went from a civilian job, leaving behind his wife and his dog, who I've seen pictures of his very cute dog, to come here and serve the people of Ohio County. So maybe he can give you a little bit of difference what his civilian life is like versus when he is on post.
So typically I work at a semi-truck maintenance shop as a service manager. So it's a whole lot different working with a small group in a kind of a field that I'm unfamiliar with, and I only have one of my personnel who's in the hospital healthcare system. So all of us are all kind of new to the system, and we're just doing our best to fit in and fill in positions that are necessary to help out the hospital nurses and administrators here.
I'm going to say one thing that we've seen from our National Guard is their willing attitude and their desire to accommodate, serve those around us. And I think that we all, students, adults, people in our community, our OCH workforce, it's something as an example for us to look at, that if we're willing to immerse ourselves in a new situation and be open to learning that we can be successful and we can help others. And we've seen that demonstrated by our National Guard over the last 2 weeks.
So, Ms. Robinson, how has this affected you and the hospital's employees?
Well, it's a challenging time in healthcare. If you choose a healthcare career, typically you're looking to serve others and to help people. One thing that has had an impact is that healthcare systems across the nation are understaffed. So while we have a lot of open positions that we are looking to hire new employees to come in and help us provide our services, at the same time, we've had a tremendous increase in responsibility for implementing testing and treatment and vaccination processes for COVID patients. So it has definitely put some stressors on our team. But I'm going to tell you what, I've watched some absolutely amazing things happen, how our employees have risen to the task and they put their patients first, and that's about schedule. A lot of that.
All students are now
Hold on, Miss
dismissed.
Robinson. I'm so sorry. That was the bell.
Not a problem.
Second Lieutenant, can you tell us, do you see the National Guard leaving the hospital anytime soon?
At this time, it looks like they'll be here for probably 2 more weeks after this Friday. It's still kind of up in the air. That decision's not up to me. But given that the hospital has been able to make great use of soldiers here, and we haven't had much downtime as far as just kind of sitting around, we'll probably be here for at least 2 more weeks helping out in similar roles and also filling in roles as they come up that are needed around here.
And one more follow-up question. What is the mission for the National Guard who are supporting the hospital?
So for both this hospital and many hospitals around Western Kentucky, the National Guard's mission is to help fill in roles that have been left empty, and to also kind of help out the nursing staff and less clinical related activities such as filing paperwork, calling up patients, answering phone calls, and the more clerical work so that the nurses can focus on all the clinical work that they need to do taking care of the patients. So our job is basically relieve the hospital staff by covering down non-clinical roles.
And Ms. Robinson, as a healthcare professional, is there any advice you want to give the students of OCMS?
Yes. I want to say that now more than ever, it's important to make an educated decision regarding vaccination. And so when we make an educated decision, that means we are going to scientific databases, scientific research, healthcare professionals to get information regarding the current vaccination. The COVID vaccination and Pfizer is available to students age 12 and up. And I really urge all of the students to not get their information from TikTok. Don't get it from social media. Talk to your parents. Talk to your family members. Ask them if you can talk to a healthcare professional. Talk to your doctor or a nurse that you trust. Anyone who has an educated scientific background to help you make a good decision. This virus does not discriminate when it comes to age, and I want all of our students of Hall County Middle School to be safe and to be protected.
Well, thank you both so much for doing this interview with us. You took the time out of your day, and we really appreciate it. Thank you so much.
You're very welcome. Thank you for having us. Y'all are doing a great job.
Thank
Thank
you.
you.